Hello, my name is Jeff Okeson. I direct the Orofacial Pain Center at the University of Kentucky College of Dentistry in Lexington, Kentucky in the USA. And I wanted to send a quick note to you because I'm going to be going to Kiev, Ukraine, in November to give a two-day program. Those dates are going to be November 12th, November 13th, 2018. And I'm going to spend some time talking with you. And my subject matter is going to be occlusion and temporomandibular disorders, and even some of orofacial pain. And I'm going to try to review some of the concepts and challenges that we have in the dental practice dealing with our patients who have occlusion problems and maybe some pain in their face. So we'll be talking about occlusion, and I'll be discussing with you the orthopedic stability that we would like to achieve as dentists so that the teeth that we fit together from an occlusal standpoint will also going to fit to the joint standpoint. We'll talk about some of the musculoskeletal conditions that occur, which we call temporomandibular disorders. And we're going to talk about muscle pain, and we're going to talk about joint pain, the clicking and popping and locking. And we're going to try to give you some insight as to what's happening, what's the etiology, when is occlusion important, when it may not be important. We're going to talk about appliance therapy. And the appliance therapy for both these two can be different. I treat muscle pain quite different than joint pain. And therefore, I'm going to show two different kinds of appliances, one that we might use for joint problems and one we use for muscle problems. And then I'm going to try to answer a question about when the appliance reduces the patient's symptoms. What do you do next? Do you need to change the occlusion or not change the occlusion? We're going to talk about some orofacial pain issues and just talk about some of the toothaches that we have to deal with in dentistry that may not be coming from the teeth. The non-odontogenic tooth where we've done a root canal and we've got an extraction and the pain still persists. So we're going to talk about some of those patients. And I'm going to try to put this all together in a two-day program, and I hope you can join me for this. This will be my second trip to Ukraine. I was there many years ago, so it'll be a new trip. And I'm looking forward to meeting you, and I hope you have some time in your practice to come spend a day with me, or 2 days with me, and we're going to talk about some of the things that I think you could do for your patient that will make all the difference in the patient's lives from a pain standpoint. So I look forward to seeing you join me, and if you have any information or want more information about this course, at the end of this little short video, we'll have a web page you can go to for more information. Hope to see you in November.